Hello and welcome to my YouTube channel. This is called Diabetes Take 2, and basically a little backstory about me. I was diagnosed at the age of 19 by a coincidence, believe me or not, on International Diabetes Awareness Day. So whether that has any relevance, I don't really know. But I've had diabetes for 11 years, and I was hospitalized about 7 months ago for a DKA. I was trying to balance my lifestyle with with um, with a high blood sugar level or something. Basically, it got out of control. I went into a coma for about 3 days, and I was discovered by my grandparents, who took me in an ambulance to a hospital, and I woke up about a week later. I have a few memories of being very, very near unconscious, and whether I was put in a medically induced coma there, I'm not sure, but I was unconscious for about a week, and I came out of it, and I am next to fully healed now. I just have a bit of a lung infection that I'm seeing off, but apart from that, I am healthy, happy, and positive. So basically, what I want to talk to you guys about is living with diabetes, whether it's type 1 or type 2. My understanding is from a South African YouTuber, I don't know his name, but I can find out. Basically, that type 1 and type 2, they run on sort of a spectrum. So you can take this as pseudoscience if you want, but maybe type 1 is not necessarily so fixed as as you might want to believe, and type 2 can also vary into, I guess, like an insulin dependent type of type 2. So I'm just running off what I know here, or what I believe, and basically I'm on a journey. I'm trying to not necessarily cure myself of this chronic condition, but somehow live with it and make sure that it has as least possible complications as possible. So basically, I'm doing my research. I'm not just making this stuff up. I've read two books so far, which is, I'm not gonna admit I'm an expert here, but I'm increasing my knowledge. I've got a third book on the go, and I mean I've got about 11 years experience as well of managing this condition, and just trying to, I suppose, go off a few maybe gut feelings, maybe I suppose assumptions. And what I've learned from reading one book is that a lot of medicine, as we know it, is actually based off assumptions. So whether we have the full picture of diabetes, I don't know. But I'd like to explore that and see whether it's possible to live with this condition and live a healthy life that doesn't involve 10 glucose readings a day, and 50 insulin injections, and just a lifetime of chronic medication and over treatment. I suppose my goal, if I do have one, is to have as few injections as possible, and to have a healthy HbA1c random glucose every 3 months. So what I'm going to talk about today is, I guess, I'm kind of trying on myself as a test dummy, a lot of different treatments. I won't go into any today, but maybe for the sake of science, I think isolating each test to see what actually works might be beneficial for others. For me, I'm just trying everything and just seeing what works. Kind of like a, I don't know, like a real yeah, just like a test dummy. Really, I'm just trying to balance this condition. And yeah, so the first thing that I'm going to talk about is basically how the diabetic is essentially taught that as soon as we get our diagnosis, we're told basically adjust our lifestyle around injecting insulin all day, and I hate it. I'm going to be forthcoming in saying that. I would rather not, but it's a reality of having this condition that insulin is actually the cure for hypoglycemia. However, in one of the books that I read of the two that I've read so far, it was actually revealed in a study on, I think, rats, that when they had their pancreases removed, and as we know, the pancreas is the insulin regulating organ in the body, they naturally tended towards diets that just had fat. Whether they could choose between carbs, I don't know if protein was there, but fat was there, and they would just eat the fat. So basically, my revelation or change in ideology here is that we don't need to necessarily eat loads of carbs and then adjust our insulin accordingly, because this is not an exact science. It's a lot of guesswork, and it results in hypos and hypers and just a whole lot of mucking around. But if we do what an animal is instinctively going to do when faced with this condition within themselves, just eat fat-rich foods. It doesn't seem like a very groundbreaking idea, and I think there are some groups out there that talk about a keto diet to heal diabetes. But yeah, this is what I'm trying. I am still eating fruit. I'm still eating vegetables. I'm still eating just a small amount of whole grain bread, and this is good. And yeah, just for those who are interested, who are watching this video, yeah, I guess just consider the fact that diabetes doesn't necessarily involve all this insulin and worrying about hypos all the time. Maybe just adjust your diet and see what happens. It could be the thing that that causes a shift in the way you view your condition. So I'll leave it at that for today. And this is Diabetes Take 2, my new channel or show or video, whatever you want to call it. And I hope you enjoy it. So continue with me on this journey. And I'm going to keep trying new things, and I'm going to keep updating and seeing how things pan out. So thank you.